And now positive developments in COVID-19 vaccines seem to be the silver lining in the dark cloud that has swamped the world for the longest period of the year 2020. Now the Kenyan government plans to roll out the Oxford-Astra Zeneca type as a frontline candidate within the first quarter of 2021. However, not every Kenyan will receive it, hence the caution not to abandon the ongoing COVID-19 prevention protocols if the infection curve is to be flattened. Kamche Menza puts these developments into perspective amid concerns over the new coronavirus strain that has emerged in the United Kingdom.
Since the first case of the novel coronavirus SARS-CoV-2 was reported in the country, Kenya, like many other African countries, have largely depended on external efforts in the race for a COVID-19 vaccine. Globally, with a number of potential COVID-19 vaccine candidates, only 2 have been approved by the U.S. Food and Drug Administration, the Pfizer-BioNTech and Moderna vaccines. The 2 that are said to have an essentially equivalent degree of efficacy at preventing symptomatic COVID-19 infection are already in use in the UK, the US and Europe. The Ministry of Health has indicated that Kenya, through COVAX, the Global Alliance in Vaccine Development, will avail a COVID-19 vaccine by March 2021. But due to logistical challenges, the order may not be from the 2 already registered ones.
As of today, we have 1 vaccine that is already registered and is in use for COVID-19. That is the Pfizer-BioNTech vaccine. This vaccine, and together with the next one called the Moderna vaccine, were developed under the same platform. However, this vaccine requires a unique cold chain system that many countries still don't have.
To this effect, the government is targeting another vaccine candidate by Oxford-Astra Zeneca vaccine, which is still under review.
And this particular one, Kenya has actually participated in the clinical trials in our Kemri Wellcome Trust Kilifi Center, and it has shown good efficacy, and based on the parameters that we are looking at, this would be one of the frontline vaccine candidates that we shall use as a country.
With the vaccine in sight, the country is expected to receive a total of 36 million doses, 24 million from the COVAX collaboration, while the other 12 million doses will cost 10 million Kenya shillings to be funded by the government. The projected distribution is that 24 million doses will cover 20% of the population, while the other 12 million doses will cover 10% to reach a target cover of 30% of the country's population. The people who will be receiving the vaccines include frontline healthcare workers, both in public and private sectors, that total 430,000, but forming only 1% of the total population. Then those aged 50 years and above, totaling to about 5.3 million, translating to about 10% of the population. Those with pre-existing conditions totaling to 4.4 million, contributing about 8% of the population. And finally, teachers and security uniformed forces totaling 830,000, forming 2% of the population.
But I want again to reiterate that the vaccine is not going to be a silver bullet, because there's no way we can be able to immunize all the 49 million Kenyans in one go. So it is imperative that we continue to obey the measures that we have put in place.
But with a vaccine in sight, experts in vaccine development have raised concerns over the emerging new variant. Dr. George Orinda is an immunologist at the biochemistry department in Kenyatta University.
We now need to participate in the evaluation of the efficacy and also to establish the other objective regarding the safety of the vaccine, which I think Kemri Welcome in Coast is doing that. But that one, to me, there are quite a bit of gaps which locally we have not addressed. One, we are trying to do an evaluation in a population which the circulating strain might not necessarily be the same with the isolate in UK.
With threats of the emergence of COVID-19 new strains, experts opine that vaccination should run concurrently with enforcement of the COVID-19 protocols if the country is to contain the impending challenges.
The aim here is what we call herd immunity. If for example, we introduce vaccination in this country next year, what is the coverage? What are we targeting in terms of the population to cover even 1 month or 3 months? Now that coverage is what will lead us to what we call herd immunity, because we thought that the exposure to the virus could lead us to herd immunity. But apparently that can be augmented by even vaccination. So if we do the vaccination, then it will give us, but how long?
Questions about the country's readiness in rolling out the vaccine have also been raised.
One, the acceptance, I've just mentioned one. Then the second thing which you need also, what is the demand? Then you have also to understand your population. Have we done the risk assessment to determine in terms of the vulnerability of the individuals we are going to start covering? People normally talk about the health workers, the elderly and all that. But you see, we have to prepare the ground.
Deputy Director, Africa Center for Disease Control, Dr. Ahmed Ogwell, says that the plan is to have all 55 member states embark on the vaccine rollout in the first quarter of next year, despite the scarcity of the 2 approved vaccines in other parts of the world.
But it is not only these 2 candidates that are in play. We have other candidates, vaccines that are also in the final stages of doing their stage 3 clinical trials, and we expect that within the first quarter of next year, at least 3, maybe 4 other vaccine candidates will have received emergency use approval. So at this stage, I cannot tell you when that will be, because it is all dependent on the kind of data that each manufacturer provides, and it is also dependent on the company actually submitting their request for emergency use.
So then that means we are banking, now that we are not sure when the stage 3 clinical trials will end, we are still banking on should I say hope that by the time we are ready to roll out, then they will have been approved, they'll have ended their 3rd stage clinical trial.
Indeed, yes. You only roll out when you have a vaccine candidate to approve. And you only roll out after you have bought the necessary doses of that particular vaccine that you have approved. So for now, we are doing preparedness, and we are working with all countries on the continent.
With Africa still struggling with a staggering economy, indicators such as ease of use of vaccine in terms of single or double doses should be considered in the adoption of the vaccine. Bottom line, experts say there is need for the country to embark on its own operational research and surveillance of the existing strains in the country to understand the mutation. The recent emergence of new strains in UK has seen countries impose travel bans in a bid to curb its spread. Kamchi Menza for Channel 1 News.